Well, I think all ophthalmologists understand that the Snellen acuity chart works very well for, say, refractive error and for refracting our patients. But when we start dealing with pathology, and of course I deal primarily with cataracts, there are a lot of shortcomings to using high contrast Snellen letters. And so it's really perhaps a disservice that we do to some of our patients where they're reassured that they're still actually functioning quite well due to the traditional Snellen metric, when in fact they actually have a disability that would be improved by cataract surgery. Well, we have the M&S system in all of our lanes. I think the key advantages are standardization and then the ability to use a remote control to very quickly modify the targets. The software now is enabling us to do many more things. They've introduced glare testing now with lights mounted right on the screen. So this is very convenient, not having to use a separate instrument to test for glare. And more importantly, there's an element now where you can test under decreased levels of contrast. Well, I think it's very nice that all in one unit we can show so many different targets, test contrast and glare without actually even moving the patient. So this allows us to get more data in a shorter amount of time. Well, I think there are certainly going to be a lot of changes ahead of us. I think traditionally third-party insurers have really left it to the doctor and the patient for the most part to decide on the appropriateness and the timing of cataract surgery. I think in the future, however, there's going to be far more emphasis on documenting outcomes and improvement, and this is where I think it'll be harder to get away just with the Snellen chart alone, particularly under high contrast. And so I think it's going to be very important to have a system such as this where the software is constantly being upgraded and improved to give us the best tools to more accurately assess functional disability from a cataract.